Hi, my name is Jiang Song, and my student ID number is 1090987, and my group is C16.
My name is Mandy, and my student ID is 1079618.
Jiang Heron described 5 interventions of personal skills. In this video presentation, we will talk about 2 interventions. First, supportive intervention on the assumption of nurse-client care inquiry.
And the second one is catalytic intervention, and I will cosplay a psychologist in a clinic situation, using John Heron's catalytic intervention to help her patient.
Hello, Mandy. How are
Hi,
you?
John. I'm not good.
Okay, what's wrong with you?
I feel cold.
Okay, so how did you sleep?
It was so bad. I was coughing all the time, and I couldn't sleep at all.
So you had a cold, and here you have some water.
Okay.
Yeah.
Thank you.
It's going to take a few days, but don't worry. And you have good sleep and good rest.
Yeah. Okay.
If you a cold towel, you might feel better.
Okay.
Feel better?
Yeah, really. Thank you.
So you don't worry. Few days and you're going to be fine.
A few days. I know it's just a couple of days and it won't be long, but it's quite annoying.
I know.
And I couldn't do anything.
I know. I understand.
Yeah.
But be patient.
Yeah,
patient.
I know. But sometimes I feel really boring.
And I got a quite a good book for you.
Okay.
You might have read it when you feel bored.
Thank you.
And also, when you feel too bad or not quite well, you can give me a call, and I'll come to see you.
Nice you.
That's all right.
Many thanks.
Bye-bye. As we can see from this scenario, the nurse played by me was using the supportive intervention skill, helping her patient by showing her loving, caring attitude. The nurse visited her patient and gave the patient physical and mental support by touching, bringing gifts, and showing her understanding. Also, the nurse was willing to provide further help when the patient is needed.
Hi, John.
Hi, Mandy. How are you?
How are you?
Not quite well.
So, what are you struggling with?
I feel quite nervous. Sometimes I just feel vomits.
Vomits? How long have you had this problem for?
I think quite long, 1 or 2 years.
1 or 2 years is quite a long time, isn't it?
Yeah.
So, when does it happen mostly?
I think when I had a lot of work and have some assignments, and I feel, too bad.
So, do you think that could be because you are stressed when you are overworked, or you are getting nervous about one of your competitions?
Probably, but I don't know.
Have you tried any method to release your feeling?
Well, I did. Like sometimes I have a sports, like jogging.
So, could this be another form of competition? Because it doesn't really relax you, actually.
Yeah, probably.
Maybe.
Yeah.
So, my advice is you could try something else, like you can do some breathing exercise. Yeah, just like this. Do some deep breath when you are anxious. And maybe you can take some tablets.
Tablets?
Yes, like rescue remedy.
Oh, I see.
You never tried it?
Oh, no, I never tried before.
Why not? Because it really helps. It works. So maybe you can try this time. And if you feel better, then that's fine. If you're not, you come back again and see what I can do for you.
Okay, that's very nice of you.
Yeah. Thank you.
Thank you.
As we can see from this scenario, the psychologist played by me was using the catalytic intervention skill, helping her patient to explore herself and finally realize where the problem is. The psychologist was guiding her patients by asking questions, repeating and emphasizing what the patient said, to lead her to recognize that her problem is she used inappropriate methods to release her anxious feelings. Finally, the psychologist encouraged the patient in a professional way to try some other methods.